Welcome back, everybody. We're diving deep today into rural healthcare. How we've been looking into how telehealth and AI can, maybe bridge that gap in access to specialists.
hmm
Well, we've got some interesting points from this article we found. Really is at this whole potential revolution from like a business angle.
Oh, interesting.
Yeah, it makes you realize it's not just about like patients getting better care,
Right.
which is obviously a big part of it. But the article really stresses how the success of rural healthcare as a whole is kind of tied to these tech advancements.
Yeah, that's a really interesting perspective. I think a lot of times these conversations get framed around, just helping people,
Right.
which is obviously important. But the article makes it clear that, limited access to care, it's an actual threat to the financial stability of these rural healthcare providers.
Yeah, for sure. It's not just about patient well-being, it's also a strategic concern for these organizations. The article really doesn't shy away from the harsh realities these rural hospitals and clinics are facing.
No, it definitely doesn't. It paints a pretty clear picture of the challenges. They're facing an uphill battle for sure.
Totally. So let's break that down a bit. What are some of the biggest hurdles these rural providers are dealing with?
Well, think about it. People in rural areas often have to travel long distances just to see a specialist.
Right.
That means treatment gets delayed, and sometimes people just give up or they end up going somewhere else altogether.
Makes sense.
And that directly impacts those rural providers. They see reduced patient volume.
And then on top of that, they're also dealing with lower reimbursements from insurance and, those government programs.
Oh, absolutely. And when those chronic conditions go untreated because people can't easily get to specialists, they can become more complex and more expensive to treat down the line.
Yeah, that's a good point.
Rural hospitals get hit the hardest by that. It
Mhm.
puts a huge strain on their already limited resources.
So it's like a vicious cycle. It's hard to break out of.
Yeah, it really is.
And then to make matters even worse, these facilities, they're already struggling to recruit and keep qualified staff.
You said it. It's like this constant catch-22 specialists. They want to be where the opportunities are, where there are more resources,
Makes sense.
which just ends up limiting the care even more in those rural communities.
It's like one problem just feeds into the next. But, that's where things start to get interesting because the article, it points to telehealth as a potential way out, almost like building a bridge to connect patients and specialists over those long distances.
It is a good analogy because telehealth, it really has huge potential.
Yeah.
Using things like video conferencing and remote monitoring those patients in rural areas, they can connect with specialists who could be, hundreds of miles away,
Yeah.
and they can do it in real time.
I mean, that's got to be life-changing for people who had had to travel for hours, just for a simple consult.
Absolutely. The impact on access is undeniable. I mean, there are studies that show telehealth can increase access to specialty care for rural patients by something like 25%.
Wow, that's huge.
Yeah, and in some areas, wait times have gone down by an average of 10 days.
That's amazing,
Yeah.
especially for people, managing those chronic conditions or those who have trouble getting around.
Exactly. And it's not just about convenience either. The quality of the care that's delivered through telehealth, it's right up there with in-person visits.
Oh, really?
Yeah, the article mentions studies that show that telehealth is just as effective as those traditional consults for a whole range of conditions: dermatology, cardiology, even mental health services.
So you're saying it's not just like a second best option, it's a legitimate alternative.
Exactly. It's
Yeah.
a way to deliver that same level of expert care, but just in a different way.
That's pretty incredible. It almost sounds too good to be true.
Right.
But wouldn't this added convenience, wouldn't that also lead to patients being more engaged with their healthcare overall?
That's one of the key points the article makes. When it's easier to get care, patients are more likely to, seek it out sooner. They'll follow their treatment plans and actually participate in managing their health.
Yeah, that makes sense.
It's a proactive approach that can lead to way better outcomes and, ultimately a healthier population.
That's a win-win for everyone.
Yeah.
But let's kind of shift gears a bit here. Let's look at this from a strictly business point of view, since that's the lens this article is using.
Okay.
So how does telehealth fit into the financial side of things for these rural providers?
Well, that's where it gets really interesting. Telehealth isn't just about improving patient care. It also opens up new revenue streams for these providers.
How so?
Well, they can expand their reach, serve more patients, and essentially tap into revenue that might have been going to those specialists in those bigger city centers.
So are we saying that this is actually a win-win for both patients and providers?
Exactly. Telehealth, it lets those rural healthcare providers offer a more convenient and accessible experience, which attracts and keeps patients in their communities. It strengthens their position in the market,
That's awesome.
Yeah.
Okay, so we've established that telehealth has the potential to, really change the game. But the article, it also talks about artificial intelligence, AI, and its role in this whole rural healthcare revolution.
Yeah, that's another really important piece of the puzzle.
Totally. So how does AI come into play?
Well, AI, it's like this powerful force working behind the scenes, empowering healthcare professionals in ways that we're just starting to understand.
Like a silent partner.
Exactly. Always working to optimize the entire system.
So how is AI actually making a difference in these rural healthcare settings? What's it doing?
Well, one of the most immediate impacts is that it streamlines those workflows.
Okay.
Things like AI-powered scheduling tools, they can automate all those appointment bookings and reminders,
Right.
which frees up the staff to focus on those more, complicated tasks.
Yeah, that's a big one,
Yeah.
especially when you consider how many of these rural facilities are short-staffed.
Exactly. AI can take care of all that routine, repetitive stuff, and that lets healthcare professionals actually spend their time, providing quality care to the patients.
That makes a lot of sense.
Yeah.
But it's the role of AI in diagnostics that really blows my mind.
I know, right? It's like something out of a sci-fi movie, but it's real. We're talking about algorithms that have been trained on massive data sets of, medical images and patient records.
Wow.
They can analyze all that information and spot potential issues way earlier, and they can do it with greater accuracy than ever before. It's like having this extra set of super highly trained eyes scanning for even the tiniest abnormalities.
So it's not just about speed, it's about improving the accuracy of those diagnoses.
Exactly. And that earlier, more accurate detection, it means you can intervene earlier and get better results for the patients. We're seeing AI being used to analyze mammograms to catch early signs of breast cancer, read chest x-rays for subtle problems, and even predict a patient's risk for certain conditions.
That's incredible.
Mm-hmm.
So much potential. And that brings us to another buzzword we keep hearing, personalized care. Is AI playing a part in making healthcare more tailored to each individual patient?
Absolutely. I mean, AI-powered chatbots are already being used to give patients basic information, answer common questions, and guide them to the right resources.
Okay.
And this can be especially helpful for folks in rural areas who might not have that immediate access to a healthcare professional, in person.
Right. So it's kind of like having a virtual health assistant there 24/7 to answer your questions and provide support.
Exactly. But it goes beyond just providing information.
Oh, really?
AI can analyze a patient's medical history, their lifestyle, all kinds of factors, even their genetic predispositions to come up with truly personalized treatment plans. It can even predict potential health risks. I mean,
Yeah.
this level of personalization, it was unimaginable just a few years ago.
It's amazing how much progress has been made. Seems like AI is making healthcare both more accessible and more personal than ever.
It really is.
Yeah.
And, the uses for AI in healthcare, they're just going to keep evolving.
Yeah.
One area that I think holds a ton of promise, especially for these rural communities, is mental health support.
That's so important,
Yeah.
especially in those areas where it's hard to find mental health professionals.
Yeah, exactly. AI-powered therapies are emerging as a really valuable way to bridge that gap. Think about things like chatbots that can deliver cognitive behavioral therapy, or even VR programs that help people manage anxiety and phobias.
Wow.
These tools, they can provide immediate support and connect patients with human therapists when it's needed.
That's really cool.
Yeah.
Okay, so I've talked a lot about the potential benefits for patients, but what about the business side of things? What's the financial incentive for these rural healthcare providers to invest in telehealth and AI? What's the bottom line here?
That's a really important question because beyond just the ethical obligation to improve patient care, there are real financial advantages to embracing these technologies.
Okay, so break it down for us. What are some of those key financial benefits?
Well, first of all, telehealth can save a lot of money.
Yeah.
Remember how we were talking about all those travel costs?
Yeah.
Well, with telehealth, you eliminate those costs for both the patients and the providers.
No more driving hours to see a specialist. Saving money on gas, time off work, even childcare.
Exactly. And those savings, they really add up, especially for healthcare systems that are serving these large rural populations. But it's not just about travel expenses. AI helps increase efficiency because it streamlines all those workflows and reduces all the administrative work that the staff has to do.
So less paperwork, less time wasted on routine tasks, and a more productive workforce.
Exactly. And when you have happier, less stressed staff, you tend to have happier patients. The article talks about how this increased access to quality care and that personalized support through telehealth and AI, it leads to higher patient satisfaction scores.
Which in turn can boost the reputation of the healthcare provider, attract new patients, strengthen their standing in the community. It's all connected.
Exactly. It's a positive feedback loop. By embracing these technologies, those rural healthcare providers, they can position themselves as innovators, as leaders in their field. That's a big deal in today's healthcare market.
It makes them stand out.
Exactly.
Yeah, it really does seem like rural healthcare providers have so much to gain from, actually using these technologies.
Mhm.
It's not just about, staying afloat. It's about really giving them the tools to thrive.
Exactly. It's about tapping into that true potential.
Yeah.
By adopting these tools, telehealth and AI, they can move beyond just putting out fires and start focusing on building a system that's, more sustainable and robust.
Yeah. So it's not just about fixing what's broken. It's about building something better, something that's, designed for the future.
Precisely. It's about creating a future where, your zip code doesn't dictate whether you have access to good health care or how far you live from, some big city telehealth and AI.
Yeah.
They're powerful tools that can really level the playing field and make sure everyone, regardless of where they live, has access to the care they need.
That's the goal, right?
Oh.
We've covered a lot of ground here from, the challenges these providers are up against to those potential solutions technology can offer. So if we zoom out a bit and look at the big picture, what are those key takeaways you want to leave our listeners with today?
For me, the biggest takeaway is that this goes beyond just technology. It's about people. It's about understanding that access to good quality healthcare, it's a fundamental right. It's not a privilege.
Right.
And it's about empowering those rural communities to, take control of their health and
It's
well-being.
about giving them the tools they need to not just survive, but to really thrive.
Exactly. By improving those health outcomes, bringing down healthcare costs, and creating a system that's more efficient and patient-centered,
Yeah.
telehealth and AI, they have the potential to really revitalize rural healthcare.
Wow.
And in turn, that strengthens the whole community.
Yeah, it's like a ripple effect, right? Better healthcare leads to a healthier population, and that contributes to, a stronger workforce, a more vibrant local economy, ultimately a better quality of life for everybody.
It really is. It's a holistic approach to community development. And it highlights the fact that investing in healthcare isn't just about, treating illnesses. It's about investing in the future of those communities.
I love that. This has been such an insightful deep dive.
Mhm.
I feel like we've just scratched the surface of this whole topic, though.
I agree. There's so much more to explore.
Before we wrap up, was there anything else from the article that really jumped out at you? Any final thoughts you'd like to share with our listeners?
The article does a great job of outlining those benefits of telehealth and AI, but it also kind of brings up a really important question that I think is worth thinking about.
Okay, I'm curious. What question is that?
Well, it focuses mainly on those technological solutions, right? But it doesn't really dive into, those social and economic factors that often contribute to health disparities in rural areas. We call those the social determinants of health.
That's a great point. Things like poverty, lack of transportation, limited job opportunities, even just being geographically isolated, they can all have a huge impact on health outcomes, regardless of whether the technology is there.
Exactly. And those factors can create barriers to accessing care even when telehealth is an option.
Yeah.
Someone might have a smartphone and good internet connection, but if they can't afford the copay, or if they don't have a reliable way to get to a clinic for a virtual visit, the technology itself won't solve the problem.
Right. It's not enough to just have the technology. You also have to address those underlying social and economic conditions that are preventing people from being as healthy as they can be.
Exactly. And that's the question I want to leave with our listeners. As we continue to push for telehealth and AI in rural healthcare, how can we also use those technologies to tackle those social determinants of health and create a healthcare system that's truly equitable and just for everyone?
That's a powerful question to consider. It reminds us that technology is just a tool, and it's up to us to use it wisely and compassionately to create a better future for everyone. We can't just throw technology at the problem and expect it to magically fix everything. We need a more holistic approach, one that tackles the root causes of these health disparities.
I completely agree. We have to recognize that healthcare is connected to every aspect of our lives, from our environment, our social connections, our economic opportunities, even our access to education.
It's about seeing the bigger picture and understanding that to achieve true health equity, we need to take a multifaceted approach.
Yeah.
It's about investing in those communities, not just investing in technologies.
Yeah.
Yeah, it's like we need to be working on both sides, tackling those immediate access issues with telehealth and AI, but at the same time, working on those long-term solutions to, address those deeper social determinants.
Yeah, that's a great way to think about it. It's recognizing that, technology, it's not a cure-all. We need a strategy that considers, All those different factors, the social, the economic, the environmental, all those things that impact health.
Yeah.
It's about looking at the whole picture, the person and their community, not just their symptoms.
It's a big challenge, but it's also a huge opportunity,
Hmm.
you know, to really rethink healthcare in rural communities.
Hmm.
Build a system that's actually equitable and sustainable. A system that supports people, helps them thrive, not just treats them when they're sick.
Absolutely.
Hmm.
And it's an ongoing process. It requires collaboration between the healthcare providers, policymakers, community leaders, and of course the patients themselves. We need everyone working together to create a healthcare system that works for everybody.
Well, this deep dive has been so insightful. It feels like we've gotten a much better understanding of just how complex rural healthcare is and the potential for technology to, address some of those challenges.
Yeah, I agree. It's a field that's changing so rapidly. It's exciting to see how telehealth and AI are being used to improve access to care and make the system more equitable and just
I hope this deep dive has inspired our listeners to, keep learning about this topic and maybe even think about how they can be a part of building a better future for rural healthcare.
I hope so too. There are so many ways to get involved and make a difference, whether it's advocating for changes in policy, volunteering at a clinic, or just staying informed about the issues.
Well said. That's a great note to end on. Thanks for joining us for this deep dive into the world of rural healthcare. We'll keep exploring this topic and others like it as we, aim to bring you the most insightful and engaging content out there.
Until next time, keep asking those tough questions, keep learning, and keep pushing for a healthcare system that works for everyone.